when the outbreak of coronavirus was announced by the Honorable Minister, we have to activate the committee to the effect that we needed to just train them on the difference between Lassa fever and coronavirus. And interestingly, there's not much different because it's the same contact tracing mechanism that we adopted in Lassa fever that we adopted also for the coronavirus. And in terms of prevention, they all have similarity. Washing of hands, using hand sanitizer, avoiding contact with suspected cases. So we already, even before the outbreak, we already had a team in place. And you will recall that this year we've been able to deal with the issue of Lassa fever to single digits. And that is to tell you how effective our committee on Lassa fever has been. Beyond that, we have the best contact tracing system in the country when it comes to monitoring and evaluating and also contact tracing those that will have been in contact with anybody suspected to have had Lassa fever. And same we have adopted in the issue of coronavirus. For the LOC, we have procured hand sanitizers. We've procured 11,500 pieces of hand sanitizers that all the athletes and officials that will be coming for the games. And also, we've also set up washing stations at all event centers and hotels that we'll be using for this game, both in UBTH, University of Benin, Obo campus, Ekan campus, Federal Government Care College, and all the hotels that we'll be using at this game. And beyond that, we're also having the bigger parks in almost all the entry points to our centers. Also, we have 15 entry point screening centers that we are this week setting up for all the teams that will be coming to Edo State. We have to go through proper screening at this entry point. We'll be having 15 entry points to the city, and we will be monitoring all states as they come into the state. This 15 points is where we are going to receive them, and we are going to screen them before they now have access to the city, and before they can have access even to the Games Village where they will be accommodated. And also we're putting in some mechanism in conjunction with our teams, daily screening for all athletes and officials. And why is that before every game, before you enter any of the centers, we'll also perform those daily screening to avoid, we don't know what will have happened the previous day, but before the start of the game, we'll have to go through another screening on a daily basis. Also, we have 2 isolation wards that we have put in place in case of any eventuality. And also, we discovered that these games, we have our athletes, some of our athletes who are foreign-based. We are we are already having discussion with the Federal Ministry of Youth and Sports and with the main organizing committee on the significance of allowing those foreign-based athletes to participate in the 20th National Sports Festival. Looking at the statistics, we have discovered that those foreign-based are just like less than 1% of the entire athletes. And so we are already looking at having a discussion with MOC and the Federal Ministry of Youth Sports to check if there's need to allow them participate, or we should exclude them from participating to avoid any outbreak. More so that some of these athletes may be coming from the country, Europe or some other country that is already. So these are not confirmed yet, but we'll be having a discussion by Monday to know if we are going to exclude the foreign-based athletes for the games. All is to avoid the danger of having to deal with it, because they will not have, some of them will not be having 14 days of grace to self-isolate, so we want to check the possibility of not allowing them to participate in the games. Also, in the level of preparedness, also we are glad to also inform you that we'll be having about 5 scanners, which will be stationed not only at the airport but at the stadium facility of the major centers. That scanner is capable of not just screening for coronavirus, also checking for fever. So we are going to be having the state government. I'm happy to announce that the state government has also procured, and we're also expecting more, 5 scanners for the purpose of screening our athletes. And we also have procured infrared, which we'll be using at interval with our team moving around, and also at all centers that this game will be. So, ladies and gentlemen, for us, the state, we are ready, and we are ready to make history. We've been on point, we've been on top of our game in the area of dealing with viral sickness. And you're also aware that Edo State, even before the outbreak of coronavirus, we have an isolation center that was already built. And I'm happy to tell you that that isolation center is already activated for these games. We also want to thank the Honorable Minister of Health and the Honorable Minister of Youth. Just yesterday, you heard from the Honorable Minister of Health that the games were ready, and the health aspect of it, we are on top of it. So in conjunction with the Federal Ministry of Health, we are making sure that we are not leaving any stone unturned as far as this epidemic is concerned. So I want to use this occasion to also appreciate the Honorable Minister of Health, and to also assure Nigerians that Edo is ready for these games, and we are determined not just to make history for having the best game ever, but to make history to the extent that we can deal with the issue of coronavirus by also monitoring all our athletes and making sure that there won't be any outbreak during the festival. The Center for Disease Control are also part of our team in the medical subcommittee. So we are putting all standards in place.
Medical coverage to the 11,500 athletes, officials, including spectators, not just to treat sports injury when it arises, but also for incidental illnesses. So we have been preparing, and we have set our plan. We mapped out our plan. We are mounting comprehensive clinics, medical centers at the Games Village, a 24 hours medical center at the Games Village that will include both inpatient admission facilities, consultation clinics, pharmacy, and the rest. We also mount one at the Samuel Bemodia Stadium. That will be running for about 16 hours from 8 a.m. till about 9 p.m. Then we're also mounting comprehensive medical centers at Ekewa campus that we'll be using for the Edo State athletes. That's where they will be based. And lastly, at the federal government guest college. Apart from the comprehensive health centers that we are mounting, we are also, we have constituted about 30 mobile units, what we call the medical units, composed of paramedics and a nurse or physiotherapist, and if need be, a doctor, depending on the sports. For all combat sports, there will be a doctor in that mobile unit. So we have about these 30 mobile units that will be stationed at every event venue. Our paramedics, when I use the word paramedics, people don't understand what it means. It's not allied to medicine. These are specific professionals that we train here in Benin, UBTH specifically. They are the ones that, like it's done worldwide, they are the first responders whenever there's a crisis. They are well trained in basic life support system, advanced life support systems, and they will be backed up by about 10 ambulances that will be stationed at intervals. They won't go around all event centers, but we have a communication system in place that we can call upon to bring them on board. So if at the point of the games, then anything happens, the paramedics, physiotherapists, the nurse, they immediately attend to it. What we saw trending recently in social media about the Nigerian League player that died, and even the first responders, they don't even know basic resuscitation model or mode. We will not happen here, we can assure you. We are recruiting about 45 paramedics well trained to do this, and we are going to be deploying defibrillators also at this event site. We also have, I talked about mobile medical units, and we are also providing, we are actually still expecting mobile ambulance carts, like a golf cart. The DGM graciously approved for us to procure 5. You will see them hopefully at the opening ceremony that will go for quick retrieval of injured athletes from maybe during a football match, sort of see this manual evacuation of the footballers or athletes. You're going to see a mobile cart that will drive in and bring them out. We have a total number of 150 medical personnel that we are recruiting, including specialist doctors. Like I mentioned earlier, we are going to recruit orthopedic surgeons and anesthetists, especially for swimming, because they will be needed for quick resuscitation if you have any drowning or near drowning incident on the swimming side. For all contact sports, we have doctors there, kickboxing, boxing, taekwondo, kung fu, and the rest will be a doctor manning those areas. Then we also have paramedics at step. They are going to be our first responders. We have nurses, we have physiotherapists, we have pharmacists, and the other auxiliary staff that will help us to manage the clinic. But another part of our remit is going to be health education and awareness. What the deputy governor spoke about is very important. But we are mounting wash stations at every event venue. Wash stations with water, liquid soap, followed by hand sanitizer. But these things are only as effective as how often it is used. So we're going to mount a campaign that please wash your hands frequently, because containing this or preventing this problem is mostly down to personal hygiene and social distancing mechanisms that are recommended by the WHO. As for the coronavirus, the deputy governor has spoken on it. Discussions are on. We are in touch with the Federal Minister of Health, the Honorable Minister himself, the DG, the Director General of the NCDC, has also been in touch with him. And the consensus is, we don't, as we speak, we had only 2 cases of coronavirus in Nigeria. One had come out negative as of yesterday. So right now, you can say one, even the one the Italian, the initial person, the index case, even him, is almost recovered fully. So hopefully this week will be discharged. So to all intents and purposes, coronavirus is not really in Nigeria just yet. The only danger, and what the Ministry of Health has done very well, is the screening and contact tracing. So the danger is, that's what the discussion is going on. We don't want an importation of any new case into the country and into these games. So like the DG rightly just said now, the foreign-based athletes, all states will follow this, and we have already told them, and the Honorable Minister of Youth and Sports and the main organizing committee are having a discussion. We are weighing the options on that. And all foreign based outlets, will they be allowed or not? It's not about the media, that will be made by the MOC in conjunction with the chairman and the Honorable Minister of Health. If we keep the disease out of Nigeria, these games are safe. Because when I discussed with the Honorable Minister, we need to balance things. We don't also want to spread panic and fear unjustifiably around the country. So we balance three things when we are considering decision making at this level. Number one, that non-negotiable. As a doctor, my remit is you don't compromise public safety and health. So whatever if these games are going to be a danger to public safety and health, the decision would have been made. I would be the one to recommend strongly. But you have to balance that vis-a-vis the social destruction and panic. Is it going to be justifiable or not? Right now, there's no justifiable reason, of course. The list of it of that Florida as important economic considerations down. So all these things we put together, we've been discussing extensively, and like the Honorable Minister of Health said yesterday in the press release, we believe the games are safe right now and we should go on. Thank you.
We have a suspected case of coronavirus. We who are especially curious people has in place the kits to test for this disease and give result within 8 hours. So that when we test and it's confirmed, we can immediately isolate the person. Already we have tested 2 samples and received one from outside the hospital and one from the hospital. Good enough is tested negative. We have enough test kits and persons who have been trained based on our experience on NASA for over the years. So the kits are available and personnel who are trained are also on ground to receive samples and make diagnosis.
Once we have that time frame, just maximum 12 hours, collecting sample, send it to them, they give us a result. That will tell us immediately how to proceed with that patient. We had one suspected case in Vector Benin Teaching Hospital about a week ago, and there was a lot of panic. But because of the rapidity of the result, when the result came out negative, everybody's mind came out at ease. So that's essentially the same model that we are looking at here. Thank you.
A journalist was called to cover the event, but the journalist refused going for the fear of coronavirus, the fear factor, I must say. Now, His Excellency, sir, apart from these measures which the state government is already putting in place, are there jingles to sensitize the athletes for them to know that their coming to Edo State is safe and their coming to meet up with thousands of persons is safe as well? Because some athletes may also have the fear factor which the journalists had just last week. This will help to avoid reducing the number of athletes.
Are we looking at the media and the potential for using especially social media to discredit the integrity of the games? Because already, I mean, this morning I was coming in from Asaba, and in there's already rumors flying. There were 3 cases found in Benin and the hospital is covering them up. So I wanted to say that we do not want such negative stories deliberately planted by mischief makers to derail all that is happening, and I thought I should bring that to the attention of the House. So that's the media side, and then the last one is related to what he said. Again, I don't know where the 15 points are, but as it concerns the ceremonies, what plans are there at least to implement basic minimal standards of, if you like, the temperature gun and all of that, to just check that persons who are coming into the arena, it may be a tedious task, we have enough time to at least do that. And that's linked to the times that we officially tell the public that the gates of the stadium will be open on that day, because you don't then want a stampede around the entry points. Those will be my comments/questions. Thank you.
We are planning with the state government, very soon will bring 5 thermal scanners. Thermal scanners are meant for spectators. So at entry point to the major venue, they are going to be scanned. So not just only for the officials, they are also considering the spectators too.
The motor park, what measure? We have 138 motor park in Edo State, including God is good and that. There's no sanitization in all the old motor park. What measure have you taken place? Transport service.
We also have the teams that go to all the motor parks, all the entry points into Edo State, from the north to the south. We have teams from the ministry and the collaborators are there on a daily basis. In fact, we made some complaints to the PG recently that we even ran short of some of the commodities like the hand sanitizers that were generously given to the management of all these motor parks, the staff and management, and of course not just to do screening, continuous sensitization and education of the staff and management. Should they have any reason to suspect any of the passengers that come in, numbers of senior officers of the ministry have been deposited at these positions, and we expect calls from them. Sometimes even my own personal numbers have been given to them. Thank you. I'll probably just add to the comments that was given by the chairman of the medical subcommittee as part of the preparedness. So the same goes that we hope for the best, that nothing sinister happens during this game, but the medicine will be prepared for the worst. So we have also referral centers within the states. Most of the teaching hospitals, University of Benin Teaching Hospital, URA Specialist Teaching Hospitals, some high-profile private hospitals within Benin, Lily Hospital, Benin Medical Centers, the Stella Obasanjo Hospital, and of course the Edo Specialist Hospitals have been designated, and we've had meetings and agreements with these hospitals to be prepared should there be any case that cannot be handled at these clinic posts within the sports villages and the stadium. These persons will be transferred to these referral centers. All the documentations have been done. We've done inspections of all these hospitals, also see the facilities that they have. Thank you.
Well, I think that we're about to breast the tape when it comes to the final stretch of preparations for the Edo 2020. I've been here a couple of times. This is about the 5th time of coming here. For the first time, I'm checking out the Games Village, Queen Idia. We've been to all 4, Akano Ibia.
Of facilities at the stadium and the Games Village, as well as the hostels for the athletes.
Yes, we started from the stadium. We looked at a section of the stadium today. We had already looked at the other parts earlier when I said it was 90% ready. When I came the last time was just rafters for the gym. We've seen that everything is almost set. By Sunday or Monday, that place will be fully ready. But I think that, like I said the last time, we must thank the Edo State government for their responsiveness. They have been consistent. As soon as lapses are noticed, the release of funds in a timely fashion. And I think that, like I said,